I joined the CVR as a clinical research fellow. During my clinical virology training, I developed an interest in viral hepatitis. So once I joined the CVR, I joined the hepatitis C program, where we try to understand the viral dynamics and how the virus behave in the patients, and the effects of the nature of the virus on the treatment outcome or on the spontaneous clearance of the patient. The CVR has this great internationally leading researcher. We have a very good group of virologists. And once I thought about having time out of my training program to join a research institute, the CVR was the first choice. You have a very wide battery of expertise, ranging from the chronic and community-acquired infections towards structural virology, viral genomics, bioinformatics, host immune response. So that kind of environment is so inspiring for any researcher, and I thought that this is the best place to be trained in and develop as a researcher. Yeah, the PhD is a difficult journey, but in the last 4 years there was some highlights actually. I would say from professional point of view, I was awarded a couple of prizes in international conferences, and that was really satisfactory when you think about moving from the clinical side toward the research side and achieve something. On a personal note, actually, I enjoyed a lot of moments with the CVR team, and that was really good experience in developing myself at a professional and personal level as well. It's the idea about a clinical research fellow that you bridge the gap between the clinician and the scientist, and to try to find a way to promote research toward the benefits of the patients. So the most difficult bit is the first year, when you start thinking differently about things, when you are confronted with all of those new techniques and new ways of thinking. Especially my project, actually, because it was involving a bioinformatic. So the first time I sat in front of that computer with that black screen, thinking about what is Linux, was really a challenge. But as I said, it's an inspiring environment, and I had a lot of support from the bioinformatics unit over here, and here we are. I always wanted to be a clinical academic, actually, since I graduated from medical school. And once I finished my clinical research fellowship in the CVR, I applied for an academic post, and I'm currently a senior clinical lecturer in the CVR, which is great to be to continue the dream at home, and honorary consultant in the clinical virology. So hopefully we will just continue dreaming about the professorship.